guys, this is Willena. I'm here at the doctor's office with my husband, and I saw this groovy transportation sign on the window that I want to share with you guys. And I also have some of the office staff who would like to share a few things. Here we go. Go ahead.
Oh, it makes their transition back from the office to the facility or to their home much easier.
So, I mean, in the medical field, we're all about patient experience, patient care. That should be one of our top priorities. Transportation plays a main role in caring for our patients at the highest level. So having transportation here as a support with the patient just provides that quality of care that we want to provide at the end of the day.
And when they leave and they don't communicate that with the staff or with the patient, they're confused, we're confused. It's just bad.
That's right. So you've had a lot of transportation providers who come and drop off the patient, and then can you share a few experiences of, I know we can't give names, of like how it affects the patient when they learn that their transportation provider is nowhere to be found?
Oh yeah, I think it's really crucial, especially with the older patients, because I had an experience with the older patient. I was scheduling for surgery. When we were done talking in the room, I told him I would come get his transportation. Came out, they weren't even here. So I'm confused, the patient's confused, and then they're waiting for hours at a time just for a ride to get back somewhere probably like 20 minutes up the road. It's ridiculous.
To add to that, that also affects their, like I said, their overall experience here. No matter their report, good versus bad, sitting in a waiting room by yourself for hours is not a pleasant experience on the patient end. So we harp on transportation and trying to keep them here with the patient.
I've also had a couple of patients who didn't want to come back for an appointment or couldn't because of transportation, because of how they were left. You remember? Well, I had a patient like that. So,
That's terrible.
Yeah, and that also affects, as far as the provider side with scheduling, that affects our scheduling. Due to transportation, most of the time that I'm front desk, I hear that they need to arrange that within 72 hours.
That's right.
Of needing to be at their appointment, and that's an issue. So trying to work on that.
That's awesome.
Yeah.
Well, thank you so much for your feedback. I know this was so impromptu, but this
No worries.
really gives us some valuable insights on what transportation providers should be niching down to create services that are really looking after the welfare and the care of the overall patient.
That's right.
All right. Thank you so much.
Thank you.
Yes,
Thank
ma'am.
you.
Thank you.
Bye-bye.